Lygia Ricciardi with the Digital Health Live Studio at CES 2019. I'm here speaking with Manny Montalvo, who's the Vice President of Global Commercial Operations at TEVA, which is a pharmaceutical manufacturer.
That's correct. Thank you very much for having me here.
Yeah, welcome, Manny.
Thank you.
So tell me a little bit about your CES experience.
It's been really exciting to walk the floor and see so many different technologies beginning to emerge. And someone that works for someone that works in the healthcare industry, seeing that convergence of data, technology, and medicine come together is very exciting.
Yeah, talk about that a little bit. So again, TEVA is a pharmaceutical manufacturer. How do you guys interact with some of the technologies we're seeing in healthcare, wearables, AI-powered solutions, all these things? What does that mean for your business?
Yeah, so we're looking for partners that are really on the cutting edge of technology, and seeing how we can apply that technology to medicines, and then taking that new product that we begin to emerge, and seeing how we can integrate data and collect the data so that we can provide better health care outcomes to patients and physicians.
Okay, and what are you seeing that's changing? What are some themes you've seen this year? Anything that surprised you?
Yeah, I think what surprises me the most is this openness and this willing to collaborate. So before, healthcare companies were more protective of their data and their products and their assets. And what I'm seeing much more now is this collaboration with technology firms and pharmaceutical industries, looking again for where we can push the data and the products. And that convergence is what's really exciting. And I think 5-10 years from now, we're going to see a wide variety of different products that are not even on the floor today. And that's what's exciting.
I imagine. That's one of the exciting things about CES, right? You see new things every year. You don't know what's going to return and become the next big thing, and some things don't return at all. But,
exactly.
I guess, are you also seeing changes in how you guys think about patients and the role of the patient?
That's a great question.
Yeah.
And I think for us, it really begins with the patients, right? What are their needs? What do they want? It has to provide a better health outcome, right? So for them, does it mean having better efficacy, more safety, or just the reduction of medicine in general? Nobody wants to be on drugs, right? Nobody wants to be on medicine. So if the technology can help us reduce those and have better days for people, I think that's a big win. And so that's how we want to make sure that we're understanding what patients really need, how we can integrate them with physicians in our clinical trials that have to be done, and again, for the pursuit of better patient days.
And are you seeing this trend toward personalization at all impacting, obviously, personalized medicine is a thing, so
yeah.
Development of either really targeted medicines that meet people's specific genetic or biometric needs or behavioral preferences, or how are you?
Yeah, so 4 years ago, this was just beginning to kind of emerge, the dialogue of personalized medicine.
Yeah.
And I think we're now 4 years into that, and so we're now beginning to grasp what does that really mean? How can we design clinical trials around that? So I think it's the convergence, that we're still evolving that, and that's also a very exciting area to be in.
Excellent. Well, thank you for joining us here today, Manny.
Thanks for having me. It's been a great experience.
Again, this is Lygia Ricciardi at the Digital Health Live Studio, sponsored by Living in Digital Times.